You may be aware that strength training helps prevent and reverse insulin resistance. You may also know that it helps you maintain your muscle mass when losing weight and maintain your weight loss. But what you may not know is how to actually do it. For example, how to get started with strength training, how to progress your resistance safely, what movements to do, and how to combine movements for effective workouts. That's what this playlist is designed to help you do. To get a download of these recommendations, along with a few sample workout plans to put it all together, you can go to zivli.com/strength or click on the link in the description. I'm Dr. Morgan Nolte, founder of Zivli. As a geriatric physical therapist, I have witnessed firsthand how common underdosing strength training is and the detrimental effects that it can have on your health and mobility. Inside our Zivli online course and coaching program, we teach you how to live a low insulin and inflammation lifestyle for long-term weight loss and better health. One of the pillars of our approach is physical activity, including resistance training. To learn more about our program, go to zivli.com/join. In this introductory video, you'll learn about how to determine the optimal amount of weight for you to lift for each exercise and how to progress the amount of weight you're lifting safely. I'll also cover how you can reduce muscle soreness after a strength workout. Let's start by how to determine the right amount of weight or load you should add to an exercise. Now, there's two ways to estimate how much weight you should lift. One is general, and the other is more specific. The general way is to go by the number of repetitions you can do of a certain exercise before reaching muscle fatigue. Muscle fatigue is when you can't do one more rep with good form. When you reach this place of muscle fatigue, your muscles will be burning and you might start to feel a little shaky. Light intensity is where you can do more than 16 reps before you reach fatigue. Moderate intensity is when you can do 10 to 15 reps until you reach fatigue. And high intensity is when you can only do 1 to 10 reps before reaching fatigue. When you're just starting out strength training, we don't suggest you use any resistance at all, and there's 3 reasons for this. First, we want you to dial in your form for each exercise. If you're adding weight to squats, but your form is bad, you're increasing your risk for injury to your knees and back. The second reason is to work on core activation with every movement. No matter if it's an upper or lower body movement, your core should always be engaged. Waiting to add external load allows you to focus on this core activation. Lastly, it allows you to focus on your breathing. You want to breathe in with the easiest part of the movement and out with the hardest part. Proper breathing will allow you to better engage your core and be able to lift heavier loads and reduce your risk for back injury. In the upcoming videos, I'll give you plenty of modifications for each exercise. If you're just starting out, pick the body weight only modification. We suggest using your phone to record yourself doing each movement and then rewatch yourself so that you can correct your form based on what you see me doing in these videos. A mirror is also helpful feedback if you have one available for more immediate visual feedback. After you feel comfortable with the movement itself, you can start to add resistance. We suggest starting at a light intensity, meaning a weight that you can lift over 15 times. For untrained individuals with no resistance training experience or who have not trained in several years, we recommend that after this initial movement learning phase and 1 or 2 sessions at a light intensity, you progress to lift an amount that produces fatigue after about 8 to 12 repetitions. For intermediate individuals with approximately 6 months of consistent resistance training experience and advanced individuals with years of resistance training experience, it's recommended to use a wider loading range. This means that instead of staying in that 8 to 12 rep max zone, you can expand to 1 to 12 rep max. You'll see greater gains in strength if you aim for lower reps with a heavier weight. And we understand that you may not feel comfortable lifting that heavy of a weight to reach fatigue by 3 to 5 reps, especially if you don't have a lot of experience or you're lifting alone. Remember that any lifting is better than no lifting. Ideally, you do want to get up into that 1 to 6 rep max zone. Because your risk of injury increases with more weight, and often people are lifting alone without someone to help them if they choose a load that's too heavy, I typically recommend staying in the 5 to 6 rep max range. You'll want to use 3 to 5 minute rest periods between sets to optimize your strength gains. And during this time, you can work on a completely separate muscle group or do flexibility or balance work. The exercises should be performed at a moderate contraction velocity, which means 1 to 2 seconds for the concentric part of the movement and 1 to 2 seconds for the eccentric part of the movement. So if I'm doing a squat, that's taking 1 to 2 seconds to go down, which is the eccentric or muscle lengthening part of the movement, and then 1 to 2 seconds to come back up, which is the concentric or muscle shortening phase of the movement. Personally, I stick with this general way of estimating exercise intensity for my workouts. One reason is that it's simpler and requires less brain power. The other is that it works in situations where you can't calculate exactly how much resistance you're getting, for example, from bands or body weight exercises like planks and push-ups. Now that you know the general way to estimate strength training intensity, let's review the more specific way, which is to calculate your 1 rep max. The 1 rep max, or 1 RM, is a common way to assess your strength. It's also used in many strength training protocols to estimate how much weight you should aim to lift. The American College of Sports Medicine describes a protocol to follow to estimate the 1 rep max, usually for multi-joint exercises that you can actually add specific amounts of weights to, like bench press or squat. And this equation works in both pounds and kilograms. There are 4 steps to estimate your 1 rep max. First, multiply the number of repetitions you can perform on an exercise to failure by 2.5. For example, if you can do 10 repetitions of the bench press, you would take 10 times 2.5, which is 25. Next, you'll subtract that number from 100 to determine the percentage of your 1 rep max. So 100 minus 25 is 75. Then you'll divide that number by 100 to get a decimal value. 75 divided by 100 is 0.75. Finally, divide the weight you lifted by the decimal value to get your estimated 1 rep max. So let's say that I bench pressed 80 pounds 10 times. I would take 80 divided by 0.75, which is about 106 pounds. So 106 pounds is my 1 rep max for bench press. Using percentages of your 1 rep max, you can be more specific about light, moderate, and high intensity training versus just going by how many reps it takes for you to reach muscle fatigue. 40 to 50% of your 1 rep max is considered light intensity, 60 to 70% of your 1 rep max is moderate intensity, and 80% or higher of your 1 rep max is high intensity. You can be specific about how much weight you're lifting using a chart like this. So if I look at this chart and find about 80 pounds at 10 reps, I can see that if I want a goal of 5 reps, I should try a weight of around 95 pounds. Knowing your 1 rep max and using a chart like this makes the math a lot easier. It can give you more confidence when selecting heavier weights and working at a higher intensity that you're not overestimating how much weight you can lift. Again, I find this most useful for multi-muscle movements that you can actually add external weight to, like the squat, bench, and deadlift. Now that you know the 2 ways to estimate your resistance training intensity, let's review how you know when it's time to increase your resistance and how to do it safely. Based on your level of experience, you'll have a goal number of reps you want to do for each exercise. If you're a beginner who's already gone through the few weeks of the movement phase and the light intensity phase, that would be between 8 to 12 reps to muscle fatigue. If you're an intermediate or advanced trainer, that range may be lower. Let's use 6 reps, for example. Regardless of your level of experience, once you can do 2 reps above your goal, it's time to increase the weight. It's recommended that you increase your weight by 2 to 10%. You'd keep this heavier weight for all of the sets of the exercise if you can, not just the first one. So if your goal is 10 reps and you can now do 12 with the same amount of weight that you have been doing, it's time to increase. Or if your goal number of reps is 6 and you can now do 8, then you would increase. For example, if you're trying to stay at 6 reps for your squat, once you can safely do 8, you would want to increase your load by 2 to 10%. So if you could squat 100 pounds 8 times, you could increase your load by 2 to 10 pounds until you're only able to do 6 reps. Then stay at that resistance amount until you can do 8 reps. When you can do 8 reps, add more weight again. If you're advanced, you can probably eyeball the amount of weight that you need to add to get back down to 6 reps or 10 reps or whatever your goal number of reps is without actually doing the calculation. The recommendation for frequency of training is 2 to 3 days per week for beginners, 3 to 4 days per week for intermediate, and 4 to 5 days per week for advanced trainers. Beginners often benefit from more total body strength training workouts since they are strength training less frequently. Intermediate and advanced trainers who strength train 4 or more days a week will usually prefer split routines, which means they might have 2 arm days, 2 leg days, and 1 core day each week. Both the total body and split training routines get you to that goal of strength training all major muscle groups twice per week. A good goal is 2 to 3 sets per exercise for a moderate intensity and 3 to 5 sets per exercise for a high intensity workout. Don't do strength training for the same muscle groups on consecutive or back-to-back days. Your muscles need at least 1 day to rest and repair. Depending on the intensity of your workout, you might even need more than 1 day to rest. If your muscles are a bit sore after the workout, that's normal. It's called delayed onset muscle soreness, or DOMS. When you lift weights, your muscle fibers get little micro tears, and as they heal back, they heal stronger. If this muscle soreness lasts more than 3 days, you probably lifted too much. If you experience joint pain or worsening joint pain than you did before the exercise, but your muscles aren't necessarily sore, that's a sign that you need to modify the exercise technique or your form, not necessarily that you lifted too much weight. You just may need to choose a different variation of the exercise that's going to feel better on your joints. A few things that will help reduce DOMS is a good warm-up and cool-down. The cool-down is especially important to flush lactic acid out of your muscles following a strength training workout. I usually just walk on the treadmill for about 5 minutes before and after my strength training workouts. We also recommend stretching the muscles that you worked following this cardio cool-down. Other things that will help reduce DOMS is adequate sleep, hydration, and nutrition. Our general rule is to aim for 7 to 9 hours of quality sleep per night. Your muscle recovery and growth happens during sleep, so it should be considered a critical part of your wellness routine. We recommend getting a dose of 30 grams of complete protein immediately after resistance training so that you can refuel your muscles. A whey protein shake, or animal protein, or another type of protein shake with at least 2.2 but preferably closer to 3 grams of leucine per serving is great. Leucine is an essential amino acid required for muscle growth and repair. A branched-chain amino acid supplement can also help you reach this leucine threshold, but in order for it to be effective, the supplement should be consumed with other amino acids and a full dose of protein. Some people also say that eating carbohydrates right after a strength training workout helps reduce their recovery time. Electrolytes may also be beneficial for you, especially if you practice intermittent fasting and you're coming into the workout in a fasted state. Cryotherapy, or a cold water immersion, can also help reduce post-exercise inflammation and reduce DOMS. Foam rolling, massage, and Epsom salt baths are also options to help reduce this muscle soreness. According to a 2019 study, initial evidence suggests that the long-term consumption of antioxidant-rich foods like tart cherry juice, pomegranate juice, beetroot juice, and watermelon juice, as well as several chronic supplementation strategies such as creatine, omega-3 fatty acids, and vitamin D3, may help to reduce symptoms of exercise-induced muscle damage and improve muscle function. Now, if you're trying to lower your blood sugar and insulin levels, just go easy on those juices. I hope you found this video helpful, and if you did, please give it a thumbs up and leave a comment. Subscribe to this channel to show your support. It means a lot to me. I also suggest watching the rest of this playlist to learn basic strength training techniques, and remember to get a download of these recommendations along with a few sample workout plans. To put it all together, you can go to zivli.com/strength or click the link in the description below.